Welcome to ETMC TV and this informative presentation by Allison Hennigan, MD, a general neurologist and clinical neurophysiologist at the ETMC Neurological Institute. Dr. Hennigan will discuss strokes. Thank you for choosing ETMC TV.
There are different levels of stroke. One is an ischemic stroke, in which case a blood clot goes through the blood vessel and blocks off blood going to a certain area of the brain, and the brain starts to react by changing, and some parts of the brain die with that. The second type of stroke is a hemorrhagic stroke, where a blood vessel bursts, and that can lead to a blood flowing into the brain, and the brain does not respond well to blood if it's not going through the blood vessel. Most people will use mini stroke to mean something called a TIA, which is a transient ischemic attack, which by definition is stroke-like symptoms that completely resolve within 24 hours and don't have any changes on MRI. No evidence of actual damage that has occurred to the brain. I like to think of them as warning shots. Your brain saying something is wrong, something needs to be fixed, or else you might suffer a big stroke. The symptoms to be aware of are any weakness of any one part of your body more than another, any asymmetry of the face, if you smile and the face is not symmetric, if you're having a severe sudden onset of a headache, if you're having any trouble with vision or paying attention to one side of space, or any numbness and inability to feel on one side of your body or the other. One of the things that people will suggest is something called FAST, which is check the face to see if it's symmetric, check the arms, raise them up like this and see if one falls, check the speech to see if it's slurred or if it's not making any sense, and then time is the T in that. So make sure to get to the emergency room as soon as possible. America is a population that we have excess, and frequently we're able to eat plenty and drink plenty and do whatever we want. So there is a high incidence of obesity, and that contributes to stroke. There's also a high incidence of high blood pressure, high cholesterol, and diabetes. All of that goes along with obesity, and all of those things contribute to stroke. If you've had a family member with a stroke before the age of 50, then that makes us think that there might be something hereditary going on. Younger people can have strokes. It can be associated with diseases like lupus and other types of things that can affect the clotting of the blood. If you have any doubt whatsoever, call 911, get evaluated as soon as possible. Even if you think it's a TIA, or transient ischemic attack, because there are things that we can do if we catch it in time. While you're waiting for the ambulance, I would suggest observing them, making sure that they're not significantly uncomfortable in any way. Getting an accurate list of medications would be another thing that's very important for the family to do. Make sure you know exactly, because it helps us if we know exactly what the patient was taking. Getting the name and phone number of the patient's primary care physician would be another good idea. A stroke center has the capability to evaluate you as soon as possible and has the best chance of getting you the only medicine that we have for acute stroke, which is TPA. TPA is a clot-busting medication that, in the case of an ischemic stroke, if you arrive at the hospital quickly enough, we can get all the tests done to make sure that you are a candidate for TPA. It is the only medication we have for acute stroke, and it has to be given within 3 hours, which usually means that you have to be at the hospital within 1 hour of the onset of the stroke. That testing at ETMC takes place very rapidly, within a rapid succession. All of our ER staff are trained in recognizing that this could be a stroke and getting people all those tests done very quickly so that you have the medicine as soon as possible. For a hemorrhagic stroke, we'll control blood pressure, because blood pressure is a big factor in preventing the stroke from getting worse. therapies are a key to recovery from stroke. So we try to figure out why it happened and try to help you recover from it as quickly as possible. We'll offer smoking cessation counseling if it's warranted. We'll look at your heart. We'll look at the blood vessels to make sure there's no narrowing that needs to be surgically corrected. So we will evaluate all those things no matter what type of stroke that you have and control the risk factors. The worst types of strokes are the ones that will affect the right side of your body, and usually those will also affect speech. And that means that it's difficult to understand words, difficult to speak, and sometimes your family members won't be able to understand you. But we do everything in our power to working with speech therapy, physical therapy, and occupational therapy to get you back to as close to normal as before. It's important for people to know that just because you've had a stroke doesn't mean your life is over. It's always a good idea to talk to your doctor about your particular situation, because not every prevention is good for every person. In general, baby aspirin once a day is good for helping to prevent stroke. Don't smoke. Smoking can be a huge risk factor for not just heart attacks and cancer, but for stroke as well. Keeping control of your blood sugar, your blood pressure, and your cholesterol are all preventative factors for stroke.
Dr. Allison Hennigan is a general neurologist and clinical neurophysiologist at the ETMC Neurological Institute in Tyler.
I started at Southern Methodist University and then transferred to the University of Texas, decided to do my medical school at UTMB in Galveston, and then decided to go on to neurology residency and then fellowship at the University of Pittsburgh in Pittsburgh, Pennsylvania, and then came back to Texas as quickly as I could.